Thank God. I'm just blessed when it comes to that.
Wow.
Those are people.
That's powerful stories.
Well,
right there.
those are just tips of the iceberg. Everybody out there that does this job says this stuff. The wages that we're not able to pay them that they should make for what they see day in and day out. One shift, you see more than the average adult will ever see in their lifetime of bad stuff. There's much more. I mean, I don't know, it gets worse than kids dying, but I mean, there's so many tragedies out there that they see day in and day out.
Yeah, and they carry it home with them.
And the mental health, we didn't know in our early days.
Welcome to In Service, the EMS podcast, where frontline experience meets leadership insight. Hosted by Jason Falvey, a seasoned paramedic and EMS leader with over 30 years in the field. This show brings you conversations with people shaping emergency medical services today. From street-level medics to innovators on the bleeding edge of EMS, we dive into real stories, leadership strategies, and what it takes to build high-performing teams in high-stakes environments. Let's get in service.
We copy you down, Eagle.
Today I'm joined by Chad Black, a lifelong EMS leader and one of the most influential voices in Georgia emergency medical services. With more than 4 decades in the field, Chad's career spans the full spectrum of EMS: paramedic, flight medic, EMS director, fire chief, and public safety director. He retired after more than 30 years with Hall County, finishing as deputy chief, and is now in his 9th year as chairman of the Georgia EMS Association, representing thousands of EMTs and paramedics statewide. Chad is also the author of an upcoming GEMS article, The EMS Profession, Stalled Between Expectations and Reality, which cuts straight to the heart of today's conversation: the growing gap between what the public expects from EMS and what the system is actually built to deliver. This episode is honest, direct, and grounded in decades of experience, from the calls that stay with you, to the leadership decisions that shape culture, to the hard truths about burnout, staffing, and sustainability in EMS. Let's get into it. Hey, welcome, Chad. Good morning. Thank you for coming in.
Good morning. Pleasure and an honor to be here.
Yeah, well, thank you very much. And I don't know if I should call you chairman, chief.
Chad works.
Chad works.
It's been that name for 59 years, and it works. As I've told people that work with me, you call me by my first name. I actually like that better.
Thank you so much for coming in. We're going to talk about the growing gap between the expectations and realities in EMS. You've written an article that's coming out soon, and we're going to explore that as well. And we're also going to spend a little time talking about Georgia EMS Association, which you're in your 9th year as chairman.
I believe that's right, yes.
Before we get into all of that, let's start with where you grew up, where you're from.
A little town called Cleveland, Georgia. It's in the North Georgia mountains in White County, just above Hall County, where I live now. People may have heard of Helen, Georgia, the Alpine Village, a great small community to grow up in. Still not huge, but it's grown a lot since I left there.
Yeah, it's beautiful at Christmas time.
It is. But grew up there. I was an only child until my senior year in high school. I've got a brother now, and his family, we adore him. I never got married, so he's got 2 daughters, and they're the joy of my family's life. My mother's younger brother was 10 years older than me, Ricky Barrett. A funny story, Ricky was the only funeral home in town at that time. Ricky was a senior in high school, standing out at a family friend beside the funeral home. A gentleman comes out one Sunday afternoon and says, "Hey, I've got an ambulance call and nobody to go with me. Can one of you boys go?" And Ricky thought, what the heck? So they go and they respond above Helen to Unicoi to Anna Ruby Falls. A person had fallen off the falls. Unfortunately, they were deceased. So Ricky kind of got hooked into the ambulance service and working at the funeral home. Ricky graduates either later that year or the next year. I can't remember. Had gone to EMT school at some point or going. So he signs up and goes to Gupton Jones School of Mortuary Science, wants to come back and open his own funeral home in Cleveland. He lives at a funeral home in Atlanta on Spring Street. They let him live there free, go to school during the day, pay him, and then at night he picks up calls for them. They had 4 or 5 funeral homes back then.
Yeah.
And Metro was the 911 provider for North Atlanta at that time, and Ricky started working for them a little bit, and they would stage there, would be their posting spot at the funeral home. So weekends, Ricky'd come get me, and I'd stay with him when he had call at the funeral home over the weekend. So got kind of got around the ambulance service then, Metro, in Atlanta. And, I'm a 8, 9, 10-year-old kid staying with my uncle and loving life. Ricky graduates 2 years later, comes back home, and he takes my grandparents' house. They give him the house, and he turns it into their funeral home and opens his own ambulance service. So pretty much I never lived at home again. I stayed at the funeral home. He lived upstairs till he got married. I stayed there with him all the time. And so at a very young age, I got to go on ambulance calls. He didn't, till I got about 14 or 15, he'd let me go on some convalescent, doctor's office if it was a family I knew, and you knew everybody in the town.
Yeah.
But back then, when you were 16, the way the rules were, if you could get your CPR certification, and you were allowed to ride on an ambulance for patient discharges from a hospital or taking a patient back to the nursing home or a doctor's appointment.
Yeah.
So then my senior year in high school, I went to EMT school 2 nights a week. You could go before you were 18. You just had to be 18 to take your Georgia State boards. And I became an EMT right out of high school. So was riding on an ambulance, really, like I said, non-emergency calls, 16, 17, and then especially 18, got my EMT. Went to work with him as I graduated, and then toward the end of that year, the funeral home decided, both funeral homes got together and said, the money's just not in the county, you're going to have to take the ambulance service over. I had unfortunately run a call right around Christmas time that prior year. My great-grandmother, who I used to stay with a lot, had gotten real sick, and I happened to ride in with them, and she arrested on the way to the hospital. So I had to witness that. I said, I don't want to work in this community and pick up my own family, all my family, both sides here. So that's when I went to Hall County in 1985 and started my career there, where I stayed 32 years and retired as deputy chief.
Wow. That's fantastic.
Yeah. Ricky I watched him as an EMT. He never got his paramedic, but I watched him as an EMT. I watched how he treated people. You've seen the movie Mother Jugs and Speed. And that happened in the funeral home days. We were up on a hill and we see the funeral home across town. We listened to the scanner. If you heard the sheriff's department put out a wreck, the other funeral home would hear the scanner call and they would jump it and go. Ricky wouldn't let us. He said, we're going to get the call. The sheriff's department would rotate calls. One time they'd call this funeral home first. If they got the call, next time them. But Ricky wouldn't let us, and it'd make us so mad because we wouldn't get to go on the call unless we got a call.
Yeah.
The phone rang. But I respected that as I got older about he did things the right way.
Yeah, professional.
And Ricky is the role model that got me started in my career, I think my 43rd, 44th year.
Wow. What was your progression? You started off as an EMT?
Started as an EMT, rode an ambulance, and then I went and got my paramedic at Hall County and rode an ambulance. And then the opportunity came where they put some of us in an active capacity, and they asked me to serve at an early role. And I talked to some people. I think I'm ready, but still, I'm going to be supervising people older than me.
Yeah.
And that made it hard. And I made some mistakes. You do.
But you're a natural leader.
I think a lot of it has to have some natural ability there, but you still got to watch and learn, and you learn from the good and the bad. I've told people this sounds bad, but I've learned more what not to do from some bad officers I worked under than I did from the good ones.
Yeah.
I did that. Little town, Habersham County, which is just north of Gainesville, near White County, had a great hospital-based ambulance service at that time, just some of the sharpest medics around.
Yeah.
And I went up there and went part-time as soon as I got my medic because we all had that extra job. I stayed there 28 years part-time. During that time, I flew for 8 years and was in air medical management for 8 years with Air Methods. Did Southeastern business manager and some business acquisitions, legislative stuff, things like that on the air medical side. When I decided to retire Hall County in 2016, I'd been at Habersham 28 years part-time. The director there said, hey, come work for me. I'm going to be retiring in a year, and I'd love to see you take over as director. I thought that'd be a great retirement job, director of a small hospital service.
Yeah.
So worked on an ambulance as a medic. I'd turned 50 and worked for a year as a medic on the busiest truck in Habersham. At that time, I loved it. Jack retired. I interviewed and was fortunate to get the director's position. About 6 months in, I get a call, and I'd started. I had 3 supervisors, EMTs, medics, had no training officer, no administrative assistant. It was me.
Real lean.
That was it, very lean. So it's getting toward budget time. It's end of September, 1st of October. And I told my supervisors, because I just got put on the board like a year earlier of the Georgia EMS Association. And I said, if I'm at a conference, I need y'all to know the county administrative. The county paid the capital, the ambulance equipment and all that, did all the maintenance, the fuel. the hospital paid the salaries and all the medical supplies and benefits. So you had to meet with both of them. My direct report was the CEO of the hospital. So gets about October, and I'd told my supervisor, I'd been making them go to, whoever was on duty, go to the county commission meeting with me, or if I had meetings at the hospital, they would go, because I said, you need to know who the players are. So if I'm out of town and something happens, you have to act in my place. And you don't need to learn the county administrator or the CEO. They need to know who you are. We're building those relationships, taking them to meetings. So I get a call.
Succession planning,
in a
way. Yeah.
But just getting them to where more responsibility, if I'm not there, somebody's got to step. I had no assistant director.
Yeah.
So I'm headed home one day. It's 5:15. I get a call from the administrative assistant for the CEO of the hospital and said, she would like to meet with you at 10 o'clock in the morning, and Phil Sutton, the county manager, will be here. And I went, okay. A new budget was coming up, and I said, this is my first budget with the hospital, so they just want to sit down and talk about budget.
Yeah.
So I get over to the hospital, and I tell my supervisor, hey, I'm going to come on over in about 15 minutes, and we'll meet with them. When I walk in, the county administrator, who had worked as assistant county administrator in Hall County, so I knew him very well. Chad, how you doing? I said, good. Mr. Sutton, how are you? And I said, by the way, I've got my captain coming. Go meet with us. Is that okay? And he went, no, this meeting is for you only. And I went, oh.
That's never good, right?
So I called Bill, and I said, don't worry about coming to the meeting. We go in, and I sit down.
But why? Why can't I come?
He was happy. He didn't like going. So that day, he was like, oh, thank goodness. I don't know what happened, but I'm good. So we go in, sit down. Mr. Sutton sitting where you are across the table. Lynn, who was the CEO at the hospital at the time, sitting by me. Phil starts off, Chad, the hospital and the county's had a good working relationship, but years ago we talked about merging fire and EMS, and now that we've got you here and your fire experience, the hospital wants to get out of the EMS business. We're going to merge EMS with fire, and it's going to be called Habersham County Emergency Services. And he kind of laughs, and he goes, you look like a deer in the headlights. I said, I'm stunned.
It's not what you were expecting.
I said, so the fire chief at the time, who I loved, great guy, and he was there, and I said, so I'm thinking all this is going through my mind, and I said, I think the world of the chief, but my question is where, and the CEO, and she goes, you want to know where you fit in? And I said, yeah, am I still going to have a job? And Phil goes, oh yeah, you're going to be basically the public safety director. You're going to put it all together, and they'll all answer to you. The county commission will vote on this in 3 weeks, but you've got to keep it a secret and not let it out and put it all together. And I said, how do I put this together without not letting it out? So we have some more conversation in there, and I get up and I'm walking. My office is, the EMS base is behind the hospital. And I'm walking through the parking lot, and I'm kind of looking up going, Lord, what are you putting on me? And my phone rings, and it's our executive director with the Georgia EMS Association. She goes, what are you doing? And I said, I can't talk right now. I just left a meeting. She goes, did you get fired? I said, no, it's nothing like that. But I said, she goes, well, I've got something I want to tell you need to know. And said, I know you knew the elections were coming up for officers. And I said, yeah. I said, I didn't put in for anything. She goes, but you got elected chairman of the Georgia EMS Association. So I hit my knees, hung up the phone, went back to my office and thought, I can't do all this. How? You find a way. You got good people around you. We merged the department. It worked out great. It became a great service. GEMSA has been phenomenal. You have your ups and downs, but they say he will never put on you more than you can take. Sometimes we feel like we're breaking, but he's not going to put more on you than you can take. I feel blessed. I guess he felt I could handle it. But you got to have good people around you. You can't do it alone. You got to have a team to do everything.
Any calls stand out to you over the years?
When you've been doing it as long as me and you have, there's a lot between. But there's two that stands out that really, I guess, just tore at my heart that I still think about a lot. And they both happen within a couple of days of each other. You always have these at the holidays. Anytime somebody loses their life, it's tragic. But when these tragedies happen at the holidays, I always think when I'm getting ready to celebrate with my family, these families always lose somebody, like the horrific plane crash yesterday of the NASCAR legend and his family.
Yeah.
From now on, every holiday, that's the first thing they're going to think of. I was at Habersham just as a medic riding, and we run a call to a motor vehicle accident at an intersection, and we get there, and I can tell when I get out of the car, the lady that's sitting in the driver's seat that's been T-boned, I knew she wasn't alive, even if, it's one of those you see. And as I get up, I hear a child speak to me, and it's a little girl in a car seat. I look, and she's okay. I check who ends up being mom, and mom is deceased in the driver's seat. I get the little girl, check her, and then I get her out, and she goes, is my mommy okay? And I broke.
Yeah.
And hugged her and got her out and assessed her. And the tragedy of that was it was a nurse that worked at the hospital, had been out Christmas shopping, and they were headed home. Dad had dinner ready, and then he gets that call. And a person under the influence of alcohol had hit him. And so it was the week before Christmas, and either the next 2 days later, I'm flying, and I'm in Griffin. And we go down to a little rural town that night near Macon, and it's a little rural hospital, probably had 4 beds in the ER. I mean, when I say rural, it's rural.
Yeah.
And a mom and daughter had been out and got hit by somebody under the influence. Mom's already deceased. They've got her laying there. And I'm flying the 6-year-old kid, same age as the other one, back to Children's Healthcare of Atlanta. Massive head injury, intubated. And I picked those 2 calls up, one ground, one air, within pretty much 48 hours of each other. Wow. And it was just the same thing, and those stuck with me. And again, I was told they'd gone out Christmas shop, had headed back, Dad was at home, got the call, and you just think how devastating that phone call can be, or somebody showing up at your door. But then you think about how many people's lives we were part of that completely changed their life forever.
Yeah.
Thousands.
Yeah.
That we don't think about it like that. They may not have died, but may have been paralyzed for the rest of their life. It was their big event. It changed their life, and you were part of that, whether good, bad, or indifferent.
Yeah.
Those stick out. That one, I mean, there's a lot that do, but really that one, those 2, just because of the timing and how similar they were.
And I've had, I had a call, this is back in the 90s, cardiac arrest, father of 3 or 4 kids. And there's not a Christmas that goes by that I don't think about that guy, about those kids growing up.
I had a similar asthma attack, and they told me I couldn't let it get this bad. I'm not going to make it. Tell my family I love them. And he walked out of the house, got in the ambulance by the time we get to the hospital. And when his wife gets there, we couldn't get him back. And it was right before Christmas, too. Same type thing. One other one that pops to mind, I had worked overtime. I'll say his name is Andy McCullers. He retired as a battalion chief with me at Hall after I left. I worked overtime with him one day. It was Valentine's Day. And I've got a history, if you ever hear the black cloud, the bad calls. I mean, when I was a battalion chief, they'd rack out a bad wreck, and it'd be like Radio Battalion 2's on scene. Or I'd call it in, run up on it. The bad calls at Habersham, I said, Lord, just put me, I guess he felt I could take care of them. I've been that way my whole life. It's a joke around where I work that something bad's going to happen, Chad's around. So I got there that morning, and I remember Andy, my partner, it was a double medic truck. He may have been an EMT. He said, Lord, what's going to happen today? We'd get the truck checked, and we get sent to a auto body shop that a gentleman on Valentine's morning went in, his wife apparently having an affair with somebody at work. He walks in with a dozen roses in one hand and a 12 gauge in the other and starts shooting, and then he kills himself. I think he shot her, killed her, killed himself, and shot the guy.
Yeah.
Or shot at the guy. But we had 2 fatalities. A very sad situation. So we worked that. We had a couple other bad calls, and then that night we went into another jurisdiction outside of ours to 2 kids missing. They said they got a babysitter who, when they found her, she's sitting at the table with cocaine on the table, and let the 2 little boys get out of her sight. So now we're helping them search for her.
Yeah.
And we're looking around the house. We go in the back, and there's a little shed. We go in and look, and nothing seems out of order, and there's a little wooden box there. And the latches were not locked, but they're just hanging down. And I don't think nothing about it. Andy, he opens one open, and when we open it up, they're both little boys with their puppy, and they're dead. The lid had closed on them, and they suffocated. Okay. And the 9 or 10-year-old's got the little 5 or 6-year-old in his arms, and the 5 and 6-year-old's got the puppy in his arms, and you could see where they'd scratched the top of the box trying to get out, and her sitting in there like nothing's happened. And the DA didn't charge her with anything, and that call really bothered me that she didn't get any charges from that.
Yeah.
And those 2 little boys died. Really stick with you.
That's heartbreaking.
It was, I mean, when I opened it up, I gasped. I almost probably passed out because I wasn't expecting it was, and you find them. And
God, how do you
how
do you continue on?
I say the Lord has been good. I've never had a nightmare. I don't have PTSD. I know some people, they say one little thing can trigger it either while you're at or after you get out of the business. And I pray I never do. I've got friends that do. I've had calls, you go back and you critique and go, I wish I would have done something different. But I've never had a nightmare about a call. Thank God. I'm just blessed when it comes to that.
Wow.
Those are the people.
That's
And
powerful
those
stories
are, well,
right there.
those are just tips of the iceberg. Everybody out there that does this job says this stuff. The wages that we're not able to pay them that they should make for what they see day in and day out. One shift, you see more than the average adult will ever see in their lifetime of bad stuff. There's much more. I mean, I don't know, it gets worse than kids dying, but I mean, there's so many tragedies out there that they see day in and day out.
Yeah, and they carry it home with them.
And the mental health, we didn't know in our early days.
Yeah.
You know, like me and I said, suck it up, Buttercup.
Toughen up.
Yeah, it's part of the
that's what
job,
we hear.
and we didn't know what we didn't know.
Yeah. Yeah, absolutely. Well, there's a lot more mental health awareness now.
There is, thank goodness, and it's getting more and more, and we've got to do more.
Yeah,
we got to
right.
address it, and it's being much more addressed than what it was, and that's a good thing.
So let's shift a little bit and talk about your leadership journey. You're going into your 9th year as chairman. So what's changed the most?
I think a lot of people think the Georgia EMS Association is a state association, and we are, but we're a nonprofit. We represent the providers, the EMTs, the paramedics, and the agencies. We're not a state department.
Yeah.
But you get a lot of calls when the OMS and trauma, who we work very closely with, and they do a great job. When there's rule changes or something comes up people don't like, we get called, me, the executive director, other board members, and we get raked over the coals. Why are y'all doing this? And I'm like, do we have some input? Yes. We get to look at rules and regs. I get them sent to me, as some others do in the state, to say, hey, before we put these out, let's debate them. I think in leadership, the biggest thing is just being consistent in how you treat everybody.
Yeah.
Human nature, we've got people we like better than others that work with us, our family and our friends. I mean, you can't help it. But you can help that you don't treat everybody the same way when it comes to being a friend or in a leadership position. You get a lot of phone calls at times. I get a lot of calls on, here's what's going on at my shop or my agency. What would you do? And I said, well, listen, let's not talk about what I do. Let's work through it. I try to tell them, support your leadership. Go be upfront with leadership. You get those calls that, well, we can't. We'll be held accountable if we say anything negative. That's what worries me is where we are. I think we've got some deep issues in some areas that maybe lack of leadership. And sometimes it's just people don't know what they don't know. You know, you've been doing it a long time. You never went to leadership classes. You may have not come up under good people. I came up under a lot of officers in the fire department that were, the majority had served time in the military.
Yeah.
And they were hardcore. Now, in today's world, I don't know that they'd have a job or they'd have a permanent sofa in human resources every day.
I don't know if that would work anymore.
But you knew where you stood and you knew what you had to do. Yeah. I just think if you ever get to a point in leadership that you feel like you can't develop and get better, I think it's time you get out.
Yeah.
I think you've got to always be willing to know that I can learn more. I worked with a great battalion chief and one of my best friends, Al Lovingood, who's fire chief in Murphy now. We had a great working relationship. He was North Battalion, I was South, and we would get new recruits out and say, you may be working for Al or in Chad's battalion, but we all work together. And listen, we may go out on a wreck today and you're brand new. And if you see something that we're doing, it could be an extrication. Yeah. And maybe we just don't, at that time, I had 25 years, whatever it was. Our lieutenants had 10 or 15. But you may see something that we just don't see. So don't be afraid to say, hey, chief or lieutenant or what about we do this?
Yeah.
You may see something we don't that day. That person first day on the job may just see it different than we all do.
Yeah.
And you got to be open to that. Just because we have all the experience don't mean we know everything. I would tell my officer when I made deputy chief and then when I made chief and public safety director, I'd say, listen, when we have these meetings and talking policy or it may be an issue, but when we walk out of this room, we're all on the same sheet of music. Now, we can debate in here, but if you want to upset me, agree with me because I've got 5 bugles or I got the title chief. And then we go out and it doesn't work and you say, well, chief, I wanted to tell you. Then I'm going to be upset. I want you to tell me if you don't feel it's a good policy or if it doesn't. Yeah. Let me know, but do not leave out of here and go, I didn't want to do it, but chief said we're going to. I said, that's not how we do this.
No, you got to unify.
That's right. We can debate in these walls. We can get mad. We can claw and fight. But when we walk out, we got to be on the same sheet of music. And I've had where, I've had an idea or whatever it was, and someone said, Chief, what about this? Or Chad, what about this? And then I look at their view and I go, I didn't think about it that way. Let's either change it. And no matter what decision you make, we can sit here on the table, Jason, all day, develop policy or a plan, but till you roll it out,
yeah.
And when you roll it out, you got to be willing to go, we didn't see that problem. Let's roll it back in and let's adapt and fix it. There's only one person that's not infallible.
Yeah.
All of us make mistakes.
Yeah, I agree. What do you think are the most misunderstood aspects of your job or your role now as chairman?
I think a lot of people think I have a lot more power than what I do to make change in EMS.
You're very influential.
I don't look at it that way. I think I've made a lot of relationships. I'm friends with people that can make change, elected officials and people like that, and they trust what we bring them because we've always brought them facts.
Yeah.
I've always said it's better to have friends that have power than you having power. I think you build those relationships over the years. I wish I had the ability to go over there and flip that switch and make EMS get reimbursement and our medics and EMTs are paid what they should be paid.
Yeah.
It should be comparable, and RNs should make every bit of the money they make.
Yeah.
But our medics that are out there in the field in an uncontrolled environment and they don't have X-ray and a doctor and a respiratory team to help, you've got to do every bit of it. You have just as much or more responsibility out in the field, and they should be compensated like an RN should. I know a lot don't have the degrees they have, and again, the RNs don't make the money they should make. I'm not disparaging that. I just think it should be more on an equal footing when you look at the responsibility.
Oh, yeah.
But having influence is a good thing as long as you use it to do the right things. We built a good network of people on our board and EMS leaders across the state with our leadership program we've done now for 14 years with almost 500 alumni. That gives you a network of people to call when you've got a question. I get calls from, hey, I know you've probably had this situation before, and you got to do that. I had two, Al Lovingood and Lanier Swafford, that I still call, but I've got other directors I can call and say, hey, now I'm not in the operations business anymore.
Yeah.
But you just build that network of consistency and trying to do the right thing for the profession, and then it pays off. Not as fast as we want it.
Yeah.
We got a lot of change needs to be made, but I tell them it's like pouring peanut butter. It just doesn't go fast.
So what is the association doing every day for its membership?
There's a lot that's changing this year. For the past 13 or 14 years, we've been doing training across the state using Trauma Commission super speeder funds, where we do about 125,000 hours of teaching a year, everything from emergency medical responder programs, EMT programs, farm extrication, tactical emergency casualty combat, which is the active shooter classes.
Yeah.
Specimen cadaver labs. We did 10 or 11 of those across the state in each region every year. Now, the Trauma Commission did not renew the contract this year, so they will do some of that on their own. We will continue to do Axioms of Leadership is one that one of our employees, they own that company, so we'll continue to do that. We'll continue to do our leadership program, probably some of the active shooter classes.
Yeah. And I just got an email, actually, on, I guess you have a leadership conference coming up, right?
We do,
Yeah.
in March. It'll be at Lake Lanier Islands in Hall County. We have two big conferences a year. We do our leadership, which is our smaller one at Lake Lanier Islands. That's a very successful show. We usually have about 50 vendors there between ambulance providers and all the equipment makers and billing and services and all that. We're very fortunate to have our vendors that support us. And then we have our big educator and providers conference in the fall every year at Jekyll Island, which we end up with about 500 people there. We were more than that. COVID kind of hit and we're building back. Still haven't got back to where we were. But we're looking at some neat things with that. We're looking at getting CAPCI accreditation.
Yeah.
And if we do that, by being at Jekyll, we want to reach out to South Carolina and Florida and maybe make it a tri-state conference every year and really build it to where it'd be huge. We do that. That is an idea to build that conference to make it better. We have some companies that sell equipment stuff that if you're a member of our association, you can get a discount on some equipment. We're very active in the legislative process. Our organization, along with the Georgia Ambulance Providers Association, GAPA, are the ones that really drive legislation. Like this year, we have a big bill coming up, or sometimes we have to fight legislation that would be negative for EMS. We've been fortunate to repel legislation that would not have been good for EMS. And when I say not good, we have to look at it, while it may be good for a certain community that's not happy with their provider, and they want to change the rules to make it better for them. Response times is always, okay, that may make it better, but what you're going to do is create in the other 158 counties a problem. We have to be very careful, and you get a lot of...
It's got to be balanced.
It does, and response times are important for those calls that need it.
Yeah.
And that's a very small percentage of those calls that really need an emergency response. We know that.
I've been reading about there's a community in South Carolina that's changing the way they're responding to emergencies now. I just read this article a couple of weeks ago. But they're not going to be responding to 80% of the calls that they run.
We've got to change. We got to make a change. 911 was, I think it was 1968. The first 911 call was in Haleyville, Alabama. And it's a great thing. But now we've put 911 over all of our trucks and call for this and that. And now it is call for everything, not just medical, not just fire and police, but, hey, the power's off. When's my cable TV going to be back on? Yeah. People don't understand when you get into response times, from the time the people in the station get in the truck, crank, and start rolling, or they're posting, they're already in it and start rolling. I don't care if you're running lights and sirens. The majority of the time, you're not going to make a 1 or 2 minute difference.
Yeah.
Especially in the traffic you have in this area where we're sitting. The real difference is made from the time somebody notifies 911 immediately, the call's processed, and the trucks are dispatched. That is where you make the biggest times. And our 911 operators are the backbone of the 911 system. We can't go without them.
Yeah.
But if they're taking the call on 911, why is my cable not on? And when's the power coming back on? And then the child gets hit by a car, but that call has to hold because they're on there. That delays that call getting dispatched. Yeah. And people don't look at they just look at the ambulance out there had the long delay. They don't look at it's a total process.
Yeah, and there's so many variables in processing a 911 call. Keying in that information and CAD-to-CAD interfaces and everything that has to occur just to get that ambulance in motion. There's a lot.
There's a lot, yes.
Yeah.
Absolutely.
Hey, it's Jason Falvey. Thank you for spending part of your day with me here on In Service. If something from this episode hit home, maybe it reminded you of a call, a shift, or a hard lesson learned, follow the show and please send it to just one person and ask them to follow. Now let's get in service. So you represent thousands of EMTs and paramedics across the state of Georgia. How do you balance the competing needs? Because you have agencies, policymakers, and the frontline providers to worry about. And there's got to be some competing needs there.
Most of the time it's not that difficult when you've got a legislator that their constituents call our response times. We can't get an ambulance in our community. We got to change it to where we can run it ourselves, fire department or whoever. And we have zoning laws in Georgia that work.
Yeah.
That is when we have to sit down and have those hard conversations. You don't want to go against a legislator, but when you talk, this isn't going to work, senator or representative, and we're going to have to fight it. And you do it respectfully. There's one, I think the world of him. We've had a couple of battles, and we still, if he's got something, he'll call and say, hey, thinking about this. It doesn't mean we don't like each other. We just have different views of where the service and the profession needs to go. That can get difficult when you got to go to hearings and get up in front of Senate representatives and you speak on why it doesn't need to happen, and you got people that why it does. And, you know, I can say this as a fire chief and loving the fire service. That was my life. But I think a lot of the fire chiefs that do first responder and not transport, and they do a great job. I think they don't realize how difficult it is to transition from a first responder to a transport service, and they can do it just as easy. And I've told a lot of them, a lot of your people work for you because you don't have transport. They want to run calls, but they want to be fighting fire, and we don't have a lot of fire. I'll ask you this, and I ask people, I mean, it's no secret, fire department's responses are overwhelmingly EMS.
Yeah.
A lot of fire departments wouldn't exist if they didn't run EMS calls. What percentage of fire calls in the country that is ran, you actually pull, percentage-wise, lines are pulled and water is put on fire now? Out of the, I think it's 250 or 300 million fire calls a year. That encompasses everything.
All right. Let me see here. It's got to be absurdly low, so I'm going to go with 5%.
About 2. Well, we've done such a good job in fire codes and building construction and things like that. We laughed years ago, said we're going to work our way out of a job. You're still going to have fires. But overwhelmingly is EMS calls. And then the other calls that are not EMS related are automatic fire alarms, that the majority of those are false. Elevator entrapments in big cities. Atlanta and places run a lot of those. And there's other calls. I mean, I'm not Fire is absolutely needed, and they serve a vital service in first responder.
Yeah.
But there's a big difference in first responding and transporting.
Yeah. We ran a call the other day for a check engine light on a vehicle.
Yeah. How that even gets through.
They put fire and an ambulance on that call. I just wonder what the caller said that triggered all that. But, okay.
Maybe they thought check pacemaker light was on or something. I don't know. But if the average citizen, business person, whoever, just went to a 911 center and spent about 3 or 4 hours and sit there and listen to the calls, just what calls came in, they would be astonished.
Yeah, and we have a dispatch center here, and when you look at the amount of work the dispatchers go through, the screens they're looking at, the calls coming in, the phone calls, it's an incredible responsibility they have. And to stay focused in that environment.
One of the hardest things I dispatched part-time at Hall County when I was younger. I did air medical dispatch, so that wasn't as bad. But dispatching the fire when I was a paramedic, I'd answer the phone, and it would be a cardiac arrest or a child not breathing. I couldn't get my hands on them. If I'm out in the field, I love it. I mean, I don't love having to work on a child, but I feel I can take care of them. I can get my hands on it. I'm doing something.
Person, yeah.
But if I'm behind that CAD and that console and I'm on the phone, I was almost gnawing through the phone because I can't get there and help you.
Yeah.
It's such a hard job that's on those dispatchers. Yeah. And people don't take that into accountability a lot. I always say our first responders include our dispatchers.
And they got to get it right.
We can't get it right if they don't get it right. Bottom line. It all starts with them.
Let's shift over and talk about your upcoming article that's going to be hitting GEMS in February. It's titled "The EMS Profession Stalled Between Expectations and Reality."
We all expect, as you should, when you need emergency service or an ambulance, call 911 and everybody wants to hang up the phone and look out the window and there's the ambulance or fire truck there to help. But that's not the reality. There are a lot of calls that have delays. The child with a 100-degree fever that's not seizing, it's okay if it's an hour before that ambulance gets, because when you take that child to the hospital, they're probably going to wait an hour before they see a doctor anyway. There's a lot of calls that's not okay, but because we're tied up on Mr. Black that hadn't felt good for a week, and I decided at 3 o'clock this afternoon when
at rush hour,
DeKalb County traffic, well, it's horrible anytime, but, I'm going to go to the hospital and see what's wrong with me. Just don't feel good, and that ambulance is taking me. The family on the other side of the station, 3 miles, child gets hit by a car, or the father falls over in cardiac arrest, and now the next adjacent jurisdiction, or could be 2 jurisdictions away, has got to come, and it's 15 minutes, and the outcome's bad.
Yeah.
When that truck should have been available to go to that true emergency. That fire truck's tied up on Chad not feeling good because they sent a first responder that really, in my opinion, they didn't need to go. Chad could have waited on that ambulance an hour. And they tell them if things get worse, call us back. And if it elevates, then you elevate the call.
I'm thinking that if Chad calls for an ambulance, they better get one there pretty quick.
Yeah, Chad's not calling for one unless he absolutely
Chad
has
shouldn't
to
have to wait.
I just use me as an example, but yes.
So what are you seeing is really out of balance here?
Everything. I mean, the number one thing that's out of balance is the reimbursement. To get one ambulance ready with an EMT and paramedic to provide service 24 hours a day, whether you're running 12-hour shifts because you're busy or you're running a 24-hour shift.
Yeah.
You're talking just on the investment of the equipment, not counting the salaries.
Yeah.
If it's a fire department ambulance, they have to have their turnout gear on the outside stored. You're talking just for the ambulance and the equipment, the stretcher, if you got a load system, and a cardiac monitor today. You know how much a cardiac new one is today? $65,000 on the low end.
Yeah.
And you're sitting there with 4 or 5 ambulances, but one ambulance, it's not unreal to have $500,000 just in the ambulance and equipment sitting there. Then you add the salaries in.
Yeah.
So they go out and they run that call. It's an LS2 call, which is one of the higher paid. The average on that, if you take all the state of Georgia and average all the LS2 calls, it's about a $2,200 call. We're getting through insurance because every insurance company, unless you have if you're a large service and you're in network, it could be different, but that's few and far between. First thing an insurance company does, we don't do a wallet biopsy. Here's the example. I get in an accident. God, don't let me get in an accident, but ambulances come transport me. They don't ask me if I got insurance. They take me across the street over here to the hospital. Hospital checks me in. If I've got critical injury or something, they're going to treat that. They're not going to check. But once they get me stabilized, anything they do for me any treatment, any rehab, any
X-ray, CAT scan.
they're going to call the insurance company and they're going to go, here's what we got to do. And then they're going to come back to me and go, here's how much the insurance company's going to pay, and here's your responsibility. We don't have that luxury in EMS. We transport, and that's it. So then insurance companies comes up and goes, you're out of network. And we get about $670-something of that, of a $2,200 bill.
Wow.
Medicare, Medicaid, much lower. It doesn't even pay for the readiness cost of buying that equipment, paying those salaries and benefits. The insurance companies have got to be held responsible, and CMS has got to do better.
Yeah.
We've got to do better. That is one of the main things. We talk about the call volumes. I was just doing a promotional interview with another department a week or so ago. They got a rescue truck there. They run 30 calls a shift in a 24-hour shift. How'd you like to go in knowing you're going to run 30 calls and they're not transporting? But those guys are exhausted. That's pretty much the whole shift you're running.
Yeah.
You're wide open. And we're wearing our people out, and we're running calls that we shouldn't be running. There's so many options out there. There's nurse lines. There's companies that Right Site, that's one that goes out and doesn't charge a service to do anything, and they will turn them over to a doctor if they don't have a primary care physician, if they don't need to be transported. And I know we have to make money, and transport is the only way. You know, we do have a thing that's just started treating no transport in the state, and that's good. There are people that we don't need to transport. We can treat in place.
Yeah.
And not tie that ambulance up, and it can be available for that next call.
But right now, unless you put them in the ambulance and drive them to a hospital, you're not getting reimbursed for that response.
We do have a treat no transport in Georgia that we just got last year. If you give D50, you get diabetic, give D50, everything's fine. I think it's $700-something you can get for a no transport now on the side. But it's pretty much no, it's transport. That's it. And there's transport. There's two revenue streams for EMS. The transport dollars that come in that does not pay for that ambulance. Yeah. So you got to make it up somewhere. And then if you're a private service running 911 or a county or city-based service, if it costs you $8 million to run that ambulance service in ABC town, and I'm bringing in $4 million in reimbursement, the taxpayers and taxes have to make up that additional $4 to meet the budget.
Yeah.
And it shouldn't be that way. I don't even like the word reimbursement. I think actually you should be able to make money off an ambulance call that helps you buy equipment and stuff to take that burden off the taxpayer. Yeah. The insurance companies and Medicare and Medicaid should be paying for this service, and you making a little bit of profit that you can put it back into the service for equipment and take the burden off the taxpayer. Because a lot of taxpayers, I've had calls, hey, I pay my taxes. Why am I getting an ambulance bill?
Because it's
the way it works.
Monitor is $65,000.
That's right.
So there's a lot of conversation about what EMS should become in the future.
Well, I think you're probably referring to as an essential service, and a lot of people want to see that. And we've had some bills come up. Do I think it should be an essential service? Absolutely. But the way the bills were constructed several years ago would have eroded and done away with the EMS zoning in Georgia. It would have pretty much opened it up to the county government. Me and you could have had one or two ambulances, never done 911, and our buddy Joe over here is the chairman of the county commission in this county.
Yeah.
And because he knew us, they could have just said, let Chad and Jason run it with no experience. And that would be horrible.
There's no doubt in my mind we'd be extremely successful, Chad. If we
Well, yeah, but the zoning is there for a reason. The zoning councils are able to see, and, you know, there's three things that they look at: efficiency, economy, and the best interest of public welfare. Yep. You got to meet all those. If you don't, they can open up the zoning. You can look at getting another zone provider, but you've got to prove those things and not just hearsay. EMS is absolutely an essential service. When you talk about safety nets, it's always a safety net hospital, but the real safety net is EMS.
Yeah.
You got to get them to the hospital some way. You can't put everybody in a car and take them.
And with the reimbursement structure as it is now, it's just not sustainable moving forward.
No, it's not. And because of that, we can't pay these providers, medics and EMTs, what they should be paid for what they are experiencing, what they're dealing with, what they see day in and day out, not even close to getting paid what they should.
And you think about it, we're coming up on the holidays now, Christmas, New Year's.
Yep.
And there's going to be staff there answering the phone. There's going to be providers getting ready to respond, and they have to be there. And the system doesn't, well, the reimbursement model we have now really doesn't provide for that.
No, it doesn't. Unless you're somewhere where you got seniority vacation or your shift, if your shift work, you're going to catch a holiday.
Yeah.
And it's just the way it works. And you know that going in. I think that, along with others, our staffing, our workforce is suffering.
From your perspective, who's carrying the largest burden here or the heaviest load of this?
The boots on the street.
Yeah.
The medics and EMTs out there carrying that burden.
Yeah.
I mean, I know there's a lot of directors and leadership that's stressed, and they worry about this stuff. I did. Never went to bed that I didn't say a prayer for my people, and still say a prayer for all of them. But, I mean, you worry about that. It keeps you up at night. It's running them on calls they don't need to go on to justify a fire budget or transports. You know, I got a director friend of mine, and I love him, but they're very critical on no transports. They look at everything. If you don't transport, they get on you. They want you to transport everything. And I'm sorry, we
absolutely look at transport percentages. It's a factor.
You have to. I get it. But we're also wearing our people out, running them on these. And again, we talked about PTSD and people, the calls I talked about, horrendous there with the kids.
Yeah, oh, yeah.
Some of those, it scarred people for life, and they have everlasting issues with that.
Yeah.
But now we're starting to see, if you really dig into the mental health aspect, a lot of the PTSD is not coming from that bad call. It's coming from these mundane, routine, over and over calls you didn't need to go on that's wearing these people out.
Yeah. They're fatigued before they even get to the serious call.
Again, you got some service still running 24s where that ambulance is running 12, 14, 15 calls, shift or more. Do you want that medic at 5 o'clock in the morning coming to your house pushing medication and they're on their 20th call?
No, I don't. But that's what it is.
Yeah.
Yeah.
And we're seeing the accidents go up. A lot of that's from, I think if we don't do something to fix the system, if you're a small rural service that runs 2 or 3 calls a day, I'm good with 24-hour shifts.
Yeah.
You know, there may be that one night you get 2 calls, and most of those are transporting to another county. But if you're busy and running those amount of calls, I'm afraid at some point the federal government's going to step in and go, okay, here's the line. If you run over this many calls a day, you cannot work a 24-hour shift.
Yeah. They don't even let truck drivers drive beyond.
No, for a reason.
Yeah.
I think our staffing issues or leadership has some to do with it, or lack of in some agencies. I think the call volumes. Now, when I first went to work, I wanted to be on the busiest fire truck, busiest ambulance there was. I wanted to run every call.
Yeah, you want to
I
get
couldn't
into
stand to be in the station and a bad call go out in the north end, and I couldn't go to it. It drove me nuts.
Yeah.
I felt like I got to be there. I need to be at that bad call or that big fire. That's not the culture today, for the most part. But we got to pay them better. We got to have better benefits. We got to have a better retirements for them. EMS, they don't have a supplemental retirement like the firefighters and law enforcement does. We've been working on that for years. Maybe starting to make some stride finally. It's our last great hope. We got to start. I think at the end of the day, the number one thing we've got to do as leaders is we've got to find ways to be creative in staffing and taking care of our personnel. We've got to take better care of our personnel and quit just running them absolutely to death. And there's so many things that comes with that, from public education to other lines of service. You know, and everybody talks about, I said medics should be paid like a nurse. And I've had people say, we need to stand up and demand we do. And I said, y'all, here's the problem. Nurses work for hospitals, doctors' offices, rehab centers, nursing homes, there's wherever. Right. And you got some flight nurses that work. But the agencies they work for, if I'm a hospital and I want to pay my nurses more, or I'm a doctor's office, I can create new service lines. I can do day surgery or outpatient surgery, or maybe I'm a large hospital and I want to start doing trauma and invasive cardiac procedures. And yet there's an investment up front in that, but it's going to have a return on your investment and bring in more money to pay them more. EMS has no service line but one thing, and that's transport. We don't have that additional service line to go, okay, yeah, I'm going to pay you more. The only thing we can do is either increase reimbursement or run more calls and make more money. But, you know, the more calls you run, the more taxing that does, the more maintenance. The reimbursement or the payment has to be better from Medicare, Medicaid, and the insurance companies.
And really, EMS hasn't seen any significant increases in reimbursements from Medicare in 30 years.
No, not anything substantial. Years ago in Georgia, they stopped paying us on Medicaid transports for the first 10 miles. We fought for years to get it back, and finally last year, thanking our senators and representatives and Governor Kemp for all approving that, but we got our first 10 miles back, which is huge. You think about it, it's $5 and something a mile. So that's $50-something for a small rural town like where I was in Habersham that's transporting that patient to the local hospital. If it was a couple of nursing homes there within a 10-mile radius, we didn't get paid for that first 10. Now, it may not be the full 10 miles, but even if it's $25, that's $25 more for that call.
Yeah. Well, diesel or gas goes up, price of that goes up every year, yeah.
Absolutely. So, I mean, there's so many things that's got to be fixed.
Do you think we're going to see EMS as a public safety function eventually migrate into the healthcare system entirely?
Well, you know, that's always been the question. Are we healthcare or are we public safety?
Yeah.
And you're a little bit of both. You're definitely public safety and you're definitely healthcare. If it was really to go into the healthcare model, your reimbursements would go up. When you think about the insurance companies paying, I think if I'm right, and I'll have to go research this again, but we're working on legislation for out-of-network insurance this year for EMS to where they would pay us 325% of Medicare allowable, and then there's no balance bill that goes to the patient. We're still the only medical entity in the state and probably the nation, EMS, that is allowed to balance bill the patient for an insurance bill. Yeah. Everybody else is, here's what they're going to pay, here's what you're responsible for. There's no balance bill. You can't balance bill for Medicare and Medicaid, only for insurance. Medicare and whatever Medicare and Medicaid pays is what you get. You can't balance bill for that. But Medicaid is only paying about 20% of that ambulance call. A $2,200 bill, you're getting $200-something, $300 for that plus mileage.
Yeah.
Now, there is not another business in this country or this world that would be sustainable the way EMS model is set up. None. The only reason it is not broken completely is because that money is put back on the back of the taxpayers to subsidize it when it doesn't meet the budget.
Yeah. So pay and staffing are frequently discussed conversations in EMS, but they're often either sidestepped rather than addressed directly. What are we avoiding discussing here?
I had a conversation with a supervisor of a fire department, fire EMS, on the way down here to do the podcast, and we were talking about that. And we know pay is nowhere close to what it needs to be for those out in the field doing the job.
And it's made some movement.
It made some movement.
But it's not, yeah, I agree with you.
It's nowhere where it needs to be for the most part, overwhelmingly, majority.
Yeah.
The problem is, especially in government agencies, you'll get a 3% bonus or 3% pay raise this year across the board. Cost of living, whatever you want to call it. Could be 5%, it just depends.
Yeah.
But then they come up because benefits are going up, and now you got to pay 4% more for your insurance. Those are the domino effects that you just never get ahead. And you got a lot of places like where I was talking here, especially governments. It's different if you get into the private hospital sectors of EMS. A lot of places, just their employees accumulate X number of hours every 2 weeks per pay period. So your people that's sitting at a desk 40 hours a week is accumulating the same off time as that person that's working 56 hours a week, working 24-hour shifts. It doesn't add up. We are different than your normal Monday through Friday employees.
Yep.
These in the field are different. They're there, as you said, on the holidays. They're there at 3 o'clock. Yes, I know. I don't want somebody to say, well, they knew what they were signing on for.
They're still away
from
their
families. I think they know what they're
signing
signing on for, but till they start doing it, they realize, I didn't know it had all this. The difference is, too, if your administrative assistant calls out sick, she's just out today or maybe 2 days. Somebody else will pick up that phone call. When I'm out, my desk is empty. The chief's not here. He's sick or whatever.
Yeah.
But when that person on that fire truck, that ambulance, that rescue truck, that ladder's out, I either have to replace them or I have to shut the truck down. It's that simple.
The calls are going to steep.
They don't stop.
Yeah, they're going to come in.
It is different. And I'm not trying to say we're better and those people in the field are better, but it is different. They are doing a different job. They're working 12-hour shifts, dispatchers in law enforcement, and the fire and EMS, a lot of them working 24.
Yeah.
Set them up on a different accumulation schedule of time off.
Yeah.
You can't treat them the same, and a lot of them do. I remember when I was a battalion chief, we went through the 07-08 financial crisis, and the county decided they were going to furlough employees. We were only running 2 people on a fire truck, of course, 2 on an ambulance. And when they come to furlough us, we said, okay, if you make me take off, somebody's got to fill my place as battalion chief. Somebody's got to move in on that engine. We'll hire. I said, that's overtime. Well, it don't matter. I said, so you're going to actually spend more money by furloughing me one shift every month.
Yeah.
But you're going to hire, and law enforcement the same way. When they took a deputy off the road, they had to pay overtime to replace that deputy.
Yeah.
But because they were afraid of the optics, we can't treat y'all different. Yeah, you can. It's public safety.
Yeah.
And you should. You could simply say, if we furlough the firefighters, EMTs, law enforcement, and 911 dispatchers, we're having to pay overtime because those positions have to be filled. And we're really spending more money. It's ludicrous.
If you take a truck off the road for the day, all we're doing is shifting the burden.
Everybody else is picking up more calls. And your wait times for 911, a call truck to come, is just going to be more because you don't have, I don't know that we don't have enough trucks in the jurisdictions to handle the calls.
Yeah.
Everybody says we don't have enough. I hear from hospital, we don't have enough ambulances. Yeah, we do. Matter of fact, I'll tell some hospitals, friends of mine, when they'll call and say, Chad, we just don't have enough ambulances to get these patients out. I say, yeah, you do. Walk down to ER and look at how many he's holding on the wall right now. Those are the ones that can't get rid of a patient, therefore come around to the other side or come upstairs and pick up your patient and take wherever they're going to.
Yeah. We could spend a whole podcast just talking about wall
patient
times.
offload times.
And the stress that puts on a system is incredible.
It is.
Yeah.
There's so much in the pay that's just, the disparities are huge, and we've got to start making strides. I was in D.C. with some of our leadership earlier in the year, and we met with some and said, you've got to change it, or it's already breaking in some areas. I read in magazines, articles, and news almost weekly. I do weekly. It's certain counties losing a service or city or folding up, and now the county's got to take over of this long-standing private company's been doing it. I mean, it's happening.
Yeah.
It's breaking.
Let's talk about educational standards. There's really a push out there to raise the educational standards, make it a degree field. What are your thoughts on that?
I'm totally against mandating the degree. The reason is we can't pay them for what they do now, and now you're going to put a financial burden on them for the ones that can't get financial aid to go get a degree, and you're not going to be able to pay them more. You can't pay them what they deserve now. And now you're going to put, am I for degrees? I'm all for degrees.
Yeah.
I'm all for it.
Yeah.
But when you mandate it and you can't pay somebody for it, you're shifting a financial burden to that employee to do something that they're going to get no monetary return from. Is it going to make them better? Yeah. Now, do I think there should be in EMT and paramedic school certain college classes required, such as writing skills and things like that? Absolutely, because of the patient care reports and how those need to be filled out and done. Now, of course, I know we got AI and everything under the sun today that me and you didn't have.
Yeah.
We were handwriting reports in our young carbon copies.
Press hard.
Yes. But I am not a supporter to mandate degrees until we can pay the people for going to get those degrees. Other states that have done that have not done very well. You've seen the workforce decrease in those areas that they couldn't pay them for. And I just think we'll erode the workforce worse than what it is now.
And we're already at a challenge. There are just not as many people coming into EMS as there once were, and even going on to become paramedics. I don't know if mandating that's going to...
I even said before I left Habersham and retired and got out of the fire EMS in 2022, I was telling my county administrator and the commission, hey, if I can hire somebody and keep them 3 to 5 years, that is an absolute grand slam.
Yeah.
We're not hiring for careers anymore in these professions. We're a stepping stone.
Yeah.
They're getting completely out of the business, going and doing something totally different. You know, from the things they have to see to the long hours to not getting paid for what they do, away from family on holidays or missing the kids' softball game or baseball or basketball. They're not wanting to do it anymore.
Yeah. You know, it's exciting. It's fun. You really do get to make a difference on some calls.
Absolutely.
No doubt
one of the
about
great
it.
jobs in the world. And
Yeah, I agree.
It is.
But when the reality of it, as you write in your article, is it's the pay isn't there. The hours are brutal. You're away from your family, and the stuff you bring home to your family.
Here's what I tell people. I don't have kids. I got my nieces, and they wouldn't do this. But I ask everybody, If you had kids or grandkids and they come to you and wanted to follow your footsteps and do what you did, would you encourage them to do it? And my answer would be, sadly, as much as I had a wonderful career and loved it. I got to fly. I got to be a fire chief. I was blessed. But no, I would not want them to do it. Go find a career that you can be home with your family and have nights you sleep and not worry and not up at 3 o'clock in the morning with freezing temperatures out. But we got to have people to do it. Somebody's got to do it. But that's sad that I think like that. Breaks my heart.
Yeah.
I want it to be a career that, yes, we'll do it. Yes, it's hard. And yes, you see bad things. But, hey, I'm making pretty good money doing this.
Yeah. At least normalize some aspect
and
of
you
it.
can get a good retirement from it. I want it to be if you work a 12-hour, 8-hour, 24-hour shift, you work your shift, whatever it is for the week, and you go home with your family. You don't have to work a second job.
Yeah.
But so many have to work a second job to provide. And when you're working 24-hour shifts, that's a third of your life you're spending with your other work family.
And it's why it's so important that people support GEMSA.
It is.
Because you're out there trying to improve all this, and membership is so important.
We've got to get more members. There's roughly 25,000 licensed providers in the state. We have a very small percentage of those that are members. I wish we had more, because when we do legislative stuff, if we were able to say we have 10 or 15,000 members, those numbers speak volumes. It brings weight. It brings credibility.
And it's important work. Beyond the clinical skills, how much does image, standards, and culture really matter to the profession?
To me, it means everything. You only get one chance to make a first impression. And I talked to some friends of mine who are fire chief stuff, and they allow it, and me and them go back and forth. But I am so tired of seeing public safety professionals out in shorts and T-shirts. I think it's a horrible look for us. Or a uniform that looks like they run over it with a car. Hair not, sticking up, looks like they didn't take a shower and clean. You should get up and get ready for work. Take a shower, shave. The men, get ready and look professional. We'll never be thought as a profession when we're out here looking like we do. I see some crews that if it was my family and somebody walked in the house to take my mother to the hospital, I'd like, no, call somebody else. You're not taking her. Not looking like that.
Yeah, and the uniforms we wear have authority built into them.
It's called a uniform for a reason.
You worked hard to get that certification, and
and I'm asked, and I say it in the article, I get, listen, why should they worry about what I look like if I'm there to save their life? Should they have a concern what I look like if I'm there to save their life? Excuse my French, but you damn right they should care. It makes a big difference to me if, and I use Miss Smith that's 80 years old that's having a STEMI or a heart attack, and somebody shows up in a professional uniform, their name's there, C Black or whatever it may be, and they're calm, they're clean. It can make a difference in that person's condition, feeling this person versus somebody that looks like they crawled out from under a rock or didn't take a shower or body odor or heavy perfume on or something. It can make a difference in their condition.
You're asking this person to trust you
with their life
in a moment of crisis.
It's there, and I tell people, even the non-emergency calls we go on that needs transported, in our eyes, this is a routine call. But that family, that is their big event for that day. That's their big event maybe for that year.
Yeah.
They don't like to have to call an ambulance, but it is so important that we get the professionalism back in. Whether we're in a new ambulance, an old ambulance, whatever, take care of your equipment, wash it, keep it clean. I can't stand getting out here and seeing trucks that look like they've been run through. It is so unprofessional looking.
We're putting sick people in the back of those trucks. It needs to be properly cleaned.
I get ice on the streets and you can't wash it, but when that weather gets clear and you get a chance, at least clean the inside. Make it look good.
Yeah.
We've lost a lot on the professionalism side, and I think it's important we get that back.
And that's going to lend itself to increasing wages and pay.
I think it helps. I think it hurts us when we don't present a professional look. I think that's a negative for us. And I don't buy that. They shouldn't care what I look like if I'm there to save their life or put their house out if it's on fire. I disagree.
They should care. Yeah. You touched a little bit on response times earlier, but for decades, response time has been treated as the gold standard here, right? That's how you measure whether a service is doing well. What are your thoughts on that?
Response times, to me, the biggest difference is made in somebody calling 911 first, processing that call, and getting the trucks rolling. Once they're rolling in most jurisdictions, lights and sirens, you're not going to make 2 minutes difference from the time the wheels start rolling. Right. And the risk is so huge. We talked about the accidents. The response times are important when it's that critical emergency.
Yeah.
Overall, for the majority of calls we run, the response time is not important. It's not going to make a difference in 2 minutes, 3 minutes, sometimes an hour is not going to make a difference in that patient's outcome.
Yeah.
And I've got people say, well, Chad, if we don't send that engine when Miss Smith don't feel good, and if it's a cardiac arrest, and I said, you're right, and that probably happens every day somewhere in this country. It does. There's going to be that call. But we have EMD dispatch or EMD where you can triage the call and you can upgrade it, and it works. Now, it's 90-something% effective. There's always going to be that one call that falls through or something happens. We're never going to be 100%. It's like I tell people, and I told the city government that we got one ambulance from our provider in our city, and they were out on a call. We had a child hit, and it took 30 minutes for the ambulance to come. I said, that's horrible. Their comment was, if somebody calls 911, we want an ambulance to respond. And I said, that is a great way to look at it, but it's not reality because of all the calls we're responding on we shouldn't be on. The only way you can do that is to have 3 or 4 ambulances sitting there where the majority of the time they're going to sit there, and if they're sitting there, they're not making money.
Yeah.
And there's still going to be a day that comes up that just happens. All 4 is going to be on a call, and that 5th call comes in. We can never alleviate that. But we can reduce those non-emergency calls down to where when the real emergency comes in, that child unfortunately hit on their bike. An ambulance is there to respond.
Only about 10% of the calls we respond to actually require a life-saving intervention.
Yes, you're exactly right. And a life-saving intervention is, I would say, less than 10%.
And so maybe another 5 to 10% of that is there's no other way they're going to be able to get to the hospital mobility-wise, so they need some type of ambulance transport. Yep. So why are we using response time as a standard to measure that other 80%?
It's ludicrous. It's something that was done. It's put into a lot of the contracts when these private providers get a 911 zone in our state. That is a metric they use. You know, you got to meet priority 1 calls by this. And I'm all for measuring that. But when you push it, then that driver pushes it and maybe goes too fast to get there to meet response times. The opportunity for accidents only increases when you're putting that back on the crew. We need to measure patient outcomes versus response times, in my opinion.
Yeah.
And there's things that we need to do, you know, having community CPR programs and AEDs that's accessible in businesses and community AEDs in subdivisions that people are trained and know that there's programs out there that does this. There's mobile integrated health, community paramedicine, there's nurse lines. Everybody's got to come together to go, how do we fix this? And everybody has a piece of the puzzle. And that includes CMS, that you've got to pay us, and insurance you've got to pay us. And there's calls that we don't have to run. Chief, leave that fire truck or rescue truck sitting there. Don't send it out on Miss Smith. Now, if it says Miss Smith is upstairs bedroom and she's 400 pounds, let's send them out there. But we can respond to them non-emergency. They ain't got to run lights and sirens. They're just going to be there to help them get that patient out. Cardiac arrest, unconscious, gunshot wound, wreck, absolutely. But these routine calls in my area, they send an engine ladder truck to a doctor's office for an elevated troponin with an ambulance. And I asked the fire chief, why? What is that $2 million ladder truck go do?
Yeah.
Well, it's in the city. They got a doctor and a nurse there. And really, that ambulance could go non-emergency. There's no reason for emergency with elevated troponin. They're going to take them to the hospital, run tests, watch them. If it's cardiac arrest or something, absolutely, they need help. But what is your 3 guys on that engine going to do, or that ladder truck, to go to that doctor's office, lights and sirens, risk people's lives, and probably not even go touch a stretcher? They're going to walk upstairs even if they do that. And I'll give you a perfect example. I was working with a service in the metro area a couple of years ago, was pulling a shift on an ambulance, still loved to work on the ambulance, so I jumped on opportunity. It's a Sunday afternoon. We get sent to an urgent care for a heart attack. So we get there 10 minutes later. Rescue truck is sitting out for that fire department in front of the urgent care with its lights still on. So I get out. As I'm getting out, I see the 2 guys get out of the rescue. They're sitting in the rescue truck. So they get out. I walk over as I'm walking into the office, and they hand me a little sheet of paper, and it's got vital signs. They had responded to emergency.
Right.
They had walked in and asked for what the vital signs were, wrote them down, and they walked out and got in the truck sitting there with lights on it. When I got out, they handed me that. What purpose did they serve responding to that call?
Yeah.
And when I got in there, guess what? Wasn't a STEMI. When we did put him on the monitor, did a 12 lead, and he said, I feel fine. It was not a STEMI, and he said, I'm not going to the hospital. We actually got a release for that. But even if it was, all they did was respond to emergency, to walk into the front desk, write down vital signs, walk back out, get in the truck, and wait on us to get there and hand it to justify a call volume. That is not what we need to be doing. We need to be available for the calls. That structure fire that comes in, they need to be available for that. Those are the things that we've got to fix, and we've got to get private, government, fire-based. We've all, in the hospital system, the patient offload time. We've all got to sit down and work this stuff out, and there's ways to do it. We may not fix everything, but we can make it a lot better than what it is today, in my opinion.
What do you think the long-term impact is on providers in the system?
I think that's adding to PTSD of running a lot of calls that you don't need to be running. And there's some that loves just to run calls, but I think a lot of these that are getting, as we say, laugh skull drug every day, and you're running that 3 o'clock in the morning call that you didn't need to go on when you could have stayed in bed and slept. It's harming it. I think it's reducing and taking them out of the workforce.
Yeah.
I think it's having long-term medical effects on some people. There's no doubt it is.
Yeah. And if nothing meaningful changes in EMS, where do you think this profession's headed?
I think it's going to completely break, and we're going to have to completely redo it, tear it down to the lug nuts, and rebuild it. This model has never been for sustainability from the 60s when EMS started. They've toyed and made some changes. There's been some positives. There's been negatives, but we've got to build it to where it's a sustainable model and it actually operates, because it is a business. It is a business just like hospitals are taking care of people. If hospitals don't make money and they're closing up in the rural areas, they're shutting their doors because they're not putting it back on the taxpayer in most areas. But in EMS, the taxpayer is going to take the brunt. They're going to go up on their taxes, and it shouldn't be that.
Yeah.
It should be able to sustain itself and make it. And it's going to take the insurance companies, Medicare and Medicaid with CMS, and they've got to do the right thing. And I don't know in my time and yours that we're going to see that, sadly.
Yeah.
It's very frustrating. It makes you just want to go home and go, I'm done. But I can't. I got to see it better before I completely give it up.
Yeah. Well, I want to see it better before I need it more.
Before I'm one and got to be using the service.
So where do you think the biggest opportunity for improvement is? You've hit a lot of points here, and your article's fantastic.
Well, thank you.
People really need to seek it out and read it.
I think in leadership, you can always make change, improving your leadership and improving your organization. And I believe in servant leadership. I did it because I loved it, because I still love working on the truck.
Yeah.
I had, right before I retired, a couple of months before I retired, COVID was going on, and one of my lieutenants, I didn't know, but they come to me and said, hey, with our staffing, he had put in for vacation, had already paid for a campsite and his family, and I can't let him off this weekend. We're too short. They had somebody sick. We had people out COVID. And I said, no, don't. He'll waste. No, let him go with his family. They're going camping. They've already paid for it. Let him go. He said, we can't staff it. I said, I'll go work for him. They said, you're going to work the 24? I said, yeah. They said, Chief, he's on the med unit that day, the busiest med unit. And I said, that's okay. So I went in and worked. I got drugged. I run 14 calls. Up all night. I'll never forget,
No
though,
good deed.
I'm sitting at the ER in Gainesville, and one of the guys, a friend of mine that worked, he come in, he went, what in the world are you doing? And then the next thing I know, he posted on the internet all over, look at this chief doing a trip report. But I don't do it for that. I don't care how big you are, how big of an agency. If you're the chief or director and you don't get around to your stations and just occasionally drop by and how y'all doing, if you can still go work in the field and show them you'll get out there with them, any massive weather phenomenon, snow or the hurricanes that we have, the outer bands of that hitting up here, I was right out with them. Now, number one, I did it because I still love running calls.
Yeah.
The body can't take it as good as it used to, but I still love it. But you don't understand what that does to your personnel when they see you'll still get out there with them and get in the trenches and do the work. It just builds so much positive momentum, and I just think we've got a lot of leaders that once they get into that administrative shift stuff, you lose grasp of what goes on out there. I don't care how long you've done it. If you're not still out there, you're going to lose grasp. I just think the leadership's got to change in a lot of places, and really servant leadership, you're there to provide them the tools to do their job. You got to listen to them. You got to have an open door. Again, there's still a chain of command, certain things that needs to go through the ranks. But the reimbursement's got to change. We got to be paid for what we do. And I joke with the State Office of EMS Director, me and him joke back and forth, Michael Johnson. Reimbursement to me means you're just getting paid to meet budget of what it costs to do the job. It really should make some money to help purchase equipment and not put the burden back on the taxpayer.
Yeah, and to upgrade
We
equipment.
pay for insurance premiums. They should pay us when we need the insurance instead of doing what they do. When you look at the billions and billions that the insurance company make in profits every year, it is disgraceful to me what they're paying ambulance bills. In looking at our billing, EMS transports are less than 3% of insurance companies' total payments. We're a very small percentage of what they pay out.
Yeah. And that's why the association is so important. That's why people have got to join it.
We got to get traction. The more we have, the better we are. We're working on things. We've got a lot of things coming down the pike. You're talking about workforce development, the Rural Health Transformation Fund I talked to you about.
Let's talk about
The big, beautiful bill that some like, some don't. So we've got to deal with it. The federal government is infusing in what they call the Rural Health Transformation Fund, $50 billion over the next 5 years into all the states for rural health care. One of the carrots of it for EMS and for the states, and we've been told from the assistant commissioner for CMS that EMS has to be included or the states probably won't get their funding. It's not just for hospitals to use for rural hospital needs. So there's roughly 100 and I think by HRSA, maybe 18 counties somewhere in the state that's considered in their eyes rural. And there's more than that under DCH standards, Department of Community Health. We applied GEMSA with GAPA, and we had some of our lobbyists that helped, but we applied for $39 million of that money that Georgia will apply for over the next 5 years to put out to help workforce development and put out 1,350 new EMTs and paramedics, 1,000 EMTs and 350 paramedics. With an 80% pass rate, we hope, or higher.
Yeah.
Reduce the workforce turnover by 15% at the end of that 5 years. That'll be roughly $7.8 million a year that will go to paying an EMT and paramedic salary. It'll pay them a salary to go to school, and it will pay them their books, their tuition, if they had to have a uniform, for clinicals, things like that. That's going to be huge for Georgia. We got a lot of work to do. We're working hard on that now. That's going to take a lot of legwork, but we will get that done. Working with the Department of Community Health had some to do with it. Now we're working with a firm that the state has hired to kind of oversee this, and Department of Public Health. That's going to be a challenge, but hopefully after 5 years we have all 1,350, and they're still working in the field. So that's huge for our state on the EMS side. Looking forward to that. I don't know that I'm looking forward to the work, but there's going to be a lot of legwork into that.
Wow. That's fantastic. So we were talking on the phone the other day, and I mentioned that old paramedics never die. They just stop showing up one day.
That's right.
That's kind of...
I don't know that I'll ever stop showing up until I die. But
So a paramedic or an EMT spends 20, 30 years serving their community, and one day they want to retire. What are the financial security options?
Well, it depends on where you work. There's very few pensions left in the public sector or private. It's mostly defined contribution. You put in and they match a certain amount, and then you can draw it after a certain age. For the ones that still have pensions, that's great. I wish I'd have had that. In Georgia, if you're a firefighter, you can be in the firefighter's pension fund. If you're a law enforcement officer, there's a couple of options, police benevolent, sheriff association. But there's nothing for EMS unless you're a fire department or you're a EMT paramedic that's worked for law enforcement or something like that. So before I got on the board, they were working to find a supplemental retirement or benefit for the EMS, for those just in EMS only. And the problem is your fire departments are city, county government. Your law enforcement, of course, is city or county government or state. EMS, we have private providers that do a great job, whether they're doing the interfacility, the non-emergency, or they have a 911 zone. We got some we've got some large hospital-based systems now again in Georgia with the takeovers of smaller hospitals. And you have your government, whether it's a city, county ambulance service or a fire-based ambulance service, transport. There is no one retirement for all of those. ERISA laws, which oversees the retirement stuff, you got a retirement for city or for county workers, you got a different retirement for city. Hospital has their stuff, private sector theirs. So we have worked and we've run into dead end after dead end. I've been to D.C. We had a company that wanted to pay us pay them roughly $100,000 to approach Congress several years ago to get the ERISA laws changed to make a retirement for EMS. But there was no guarantee. I said, if you give me 90% guarantee, no, I can't. We couldn't spend that kind of money. Yeah, not membership. We had some final straws, gasp, and working on things. About 6-8 weeks ago, I had a conference call with an ERISA attorney, a group that had put together for me. And she agreed, said, Chad, I'll give y'all a RFP. And it was $5,000, but she was going to look at it. She goes, Chad, you're right. I don't know if, and she's the guru in this area out of Atlanta. And she goes, but Chad, you're right. I don't know of a retirement, but we'll research it for you. But we couldn't spend $5,000. With her telling me that, I know. So two guys that was part of another company that kind of was helping us went to get a drink that afternoon. They said, Chad's just deflated. We've tried this since I've been on the board. And we've been told we can do it, and then no, we can't. Your balloon popped. So I get a call the next week that said, hey, we got to thinking about something. I said, y'all, because I told them, I said, we're done. We're just going to have to tell there's no way to do this. But they came up with an idea. I'm not going to go into the details, but they said, what do you think? When they told me, I said, I hadn't thought outside the box on that. And it's a way to do it with a benefit. You can't use the word retirement or anything like that, but there is a way to do it. And they said, we'll check with some ERISA attorneys. If we get that we can do it, we'll get back to you. So about a week later, they got back and said, hey, we can set this up and do it. The other thing is we've got about 16 other states. We're part of their EMS associations. We all work together. Other states would be interested in looking at this for their state too, so we can make this a multi-state thing. So 2 weeks ago, I got in the email that they are, after the first of the year, so we had to sign an NDA, which was happy to do because this is their little thing, and of course they'll make some money on it, but there is a possibility here. The biggest obstacle now that's going to be, I think, we're going to be able to do something. But it's going to be raising seed money to get some funds to start accruing. I'm not going to benefit from this or somebody that's been in it. But there could be a possibility if somebody wanted to, if I got 10 years in and I want to buy my 10 years back, this would create an option that could do that.
Wow.
And I don't know what the dues will be. Firefighters is, I think, $25. If it's $25 or $50 a month, and then it's not going to be a retirement that you're going to live off of, but it's going to be a supplemental like the firefighter's pension. It's about $1,200 a month that pays a car payment and insurance and other things. But right. It's a supplemental of something that you've worked for, that you put in. And the thing is, if we set it up right, your first year you may get back every dime you put in it over your career. And everything after that's free money. Yeah. It would probably be 15, 20 years or more before anybody would ever draw anything, but we're going to have seed money. It could be $2, it could be $5 million in seed money we need. So if we get multiple states to do it, that's more money going in. That's more money accruing interest over the years. I'm very excited about this. I just don't want to go into the details till we get more that we can put out, and we absolutely know we can do something. Then we're going to have to look for seed money. That's huge. If we do that, when I say I'm done.
Well, that would be one heck of an accomplishment.
Yeah. It would not be a retirement. It would be a benefit or a supplemental payment you would get upon it, but we can't call it anything that has to do with ERISA. There's different terms we're going to use, but it would be a program. It would be set up, and my biggest thing I told them is we got to make sure there's rails and barriers there that nobody 20 years down the road could take money out of it. We got to set it up the right way and make sure it's ironclad and there for the people putting into it and for their benefit.
Well, that's fantastic. That's good news.
Yeah.
That's big news.
It is. So say a prayer.
Yeah, absolutely. Chad, thank you so much for coming out here today. Man, you're doing some great work.
I appreciate it, but it's a team effort. It really is. We need more team members. We need a huge team to get over the hump.
Yeah. And, the association is doing great things for EMTs and paramedics in the state, and people really need to take a look at that and consider joining it for sure. It makes a huge difference, especially when you're battling legislation and trying to push things through. You really do need the numbers.
And one of the other things we did, I didn't mention, is this will be our 4th year. During COVID, I got a call from the governor's office back in 2021. They were giving $1,000 to every public safety professional in Georgia with COVID funds, which was great. They wanted me to represent EMS and come down and be there when the governor presented and say a few words. Yeah. When I was introduced as the chairman for the Georgia Emergency Management Association, I said, we've got to get emergency medical service recognized. Sadly, right before that, there had been a cardiac arrest during COVID at the Capitol of a very beloved member of the state workforce, been there a long time. And because of some delays in the way that 911 call was done, one person called the ambulance service, the other person called 911. They went to the wrong location. There was a delay in the person. Now, my understanding, it was a sudden cardiac arrest, but there was a delay in the response, and this was a critical emergency. That got a lot of tempers up, and that's when, boom, we're going to introduce legislation and change. We're fixing EMS. But instead of coming to us and saying, what do we need to fix it? We're going to do legislation and fix it how we want it. So what I did is I got with our board. We went to the state capitol, and I talked to a few legislative friends. I said, listen, what about GEMSA be the sponsor? We get a couple ambulance services or maybe just Grady because they're the zone provider. And we put a medic and EMT in the Capitol during legislative session. Tensions are high here. A lot of things happen.
Yeah.
They got to thinking about it and called me back. We went and had a meeting. I talked to Grady, and they said, absolutely. So this will be our 4th year where we have a paramedic and EMT during the legislative session. This past year, they called us and said, hey, even outside the session, can you just have a medic here Monday through Friday? So in the state capitol now, we have a medic that has a vest on with Grady and GEMSA, fully ALS. During the legislative session, 2 medics, sometimes 4 if a lot's going on. And now they are didn't run a lot of calls at first. Now they know they're there. They're running 40, 50, 60 calls during the legislative session.
Wow.
We've had a couple of representative senators collapse on the floor, not cardiac arrest, just medical episodes. They're so happy they're there. We're being seen at the Capitol. They're walking around, responding on calls. That is something we're very proud of, that we put medic and EMT in the state capitol, because there's a lot of people there during that time.
Yeah, it also gets recognition.
It's a target hazard. When you say target hazard, you're talking about hospitals where things can happen, and that definitely, there's some stress in that building.
No doubt about
Yes.
it. Thank you so much.
It's an honor.
I appreciate that. You guys are doing great work, and thank you.
Thank you. Hope you all have a Merry Christmas.
Thank you for listening to In Service, the EMS podcast, where frontline experience meets leadership insight. If you have found value in this conversation, please like, subscribe, share, and leave a comment. You will find links in the episode notes.